Okay, guys. I can crop this part out. That's fine. Oh, man. See?
Keep your mouse on the desk.
Okay.
There you go.
Okay, yeah.
And you can just click it on.
Okay. Let's go. Alright. So try to imagine going to the dermatologist and them telling you that you only have 2 conditions, but they don't really know which condition you have. You keep going and going, and they'll tell you one, and then they'll tell you another. And these are skin conditions. Well, that was me for the past 23 years, and those 2 conditions are eczema and psoriasis. Now, with both of these, I have stopped going at the age of about 18 because I get told you have one, you have the other, well, you have both. So today, I'm going to show you why it's important to know the difference between them so you can see how, if I knew which one it was, I'd get treated differently. So they've been known to cause confusion because of how similar they actually are. First, I'm going to talk about the uniqueness of eczema, and then I'm going to go on talking to you about psoriasis, and after that, I'm going to show you how they're both pretty similar and why they do get confused so easily. Eczema is the most common one that Americans do know. If you have a skin condition, they're going to assume that you automatically have eczema because that's the most one that they do get mistaken for. According to research, 31.6 million Americans do get diagnosed with eczema. And of that 31.6 million, 70% of them are from infancy to childbirth. Now, once you do grow, you can lose the condition, and it can kind of ease off a little bit. And 10% of that is found in children who actually get diagnosed. Now, a lot of children don't get diagnosed with it because parents just assume it's eczema, or doctors even just assume it's eczema. Dermatologists are the one that can tell the difference, and they'll let you know which is which. Now with that, the eczema is a hypersensitivity reaction that is found that causes the skin to overreact because the reaction can cause triggers and other things that could cause a condition to overreact that hypersensitivity. So it's not really found in the immune system, but Dr. Todd Hoover, said eczema isn't actually a skin disease. He says that it is an immune system disease and that it is easy to identify once you do figure out the triggers. Then you can try to do things to avoid it. Some people do go on eczema diets, and that is because they find stuff in food that they don't like, or some things that can cause it to flare up. Now there are 11 different types of eczema. Today we're just going to talk about eczema overall. Here's just a few examples of some types of eczema. Miracle also stated that there is a main difference in appearance that shows why the uniqueness of it. It does appear to be red to a brown gray that you can kind of see here. And then blisters do form on the skin and could cause it to be inflamed. It's mainly found in crooks and crevices of your elbows and knees. Anywhere that skin does touch, it does get found in. Like if you sweat a lot in a certain area, because of the touching of the skin, it can be found in. So now I'm going to talk to you about psoriasis and why it is so different than eczema and why it does get compared easily to eczema. So psoriasis is a skin condition that develops over time and gets confused with eczema. Miracle's study also showed that 7.4 million Americans get diagnosed with psoriasis, and of that, it usually forms between the ages of 16 and 35. Now, you do continue to keep and get psoriasis over age. It doesn't kind of go away. Later, we're going to show you if there is anything that can cure it. And of that 7.4 million, only 1% of children are diagnosed with it. Now with that 1%, like I did say before, dermatologists are the only ones that do actually tell you if you do have it or not. So once again, doctors will probably say they have eczema, but dermatologists are the main ones that do know. Psoriasis, it does cause a mild itching, while eczema is more of a severe itching. And pretty much what psoriasis is an overactive immune system. Your immune system is rapidly producing skin cells, and with these skin cells, your body it doesn't fast enough make them fall off or flare off, and then you get these red patches that appear on the skin because of the overreactive immune system. And there are mainly 5 different types of psoriasis. The main one is the plaque psoriasis, which is the most common one as well. With plaque psoriasis, it's mostly that one that is confused with eczema a lot. The American Academy of Dermatology kind of showed me the difference that psoriasis has with the characteristics. It does appear thick, red, and kind of scaly. And with that, mainly is on the elbows, the knees, the face, buttocks, pretty much in the different, more visible areas. And psoriasis does cause joint stiffness, and it does cause swelling as well. And not just in the patches that it is appeared in. Now, with there being so many differences between eczema and psoriasis, there are tons of similarities and why it does get confusing. Now I'm going to go on and talk to you about how they are both kind of the same. The American Academy of Dermatology shows different treatments for both of them. The medication is one thing that is pretty much the same. And with that, there's also telling you that hot showers are a huge thing that can cause it to flare up more. Now, hot showers, me even being a study shown, it lessens the discomfort of the psoriasis and eczema, so it's nice, it's burning showers just feel great. But you do have to be careful with getting out of the shower and making sure you are moisturized. And like the next one here, you do have to keep the skin moisturized because it does cause flare-up. So with keeping the skin moisturized and avoiding harsh soaps, it causes it so it doesn't flare up. And with both of those being said, it isn't curable. No matter what, you can't cure it. You could cause flare-ups, you could cause other stuff, and you can have it go away, but it can just come right back depending on the cause of it. Now, two main types of medication are the cortisone and vitamins A and vitamins D. Anything with those are both over the counter, and it can easily make it so you don't flare up at all. You can cause the itching to go away and make everything just a little bit better. Medical news today shows that, once again, the hot showers and other things can worsen or cause these symptoms. Infections or allergies, anything that your doctor told you that you are allergic to, or any allergies that you do have, they can cause both of these things to flare up. Now, with these being flared up, other things that you have to avoid are excess alcohol, smoking, and stress. Those can easily cause them to worsen and to just cause them in general. With that being said, to wrap everything up, we talked about psoriasis and eczema, how easily it can get mistaken for being one and the same, with mostly 40 million Americans having it. Now, there's probably more, but some just don't get diagnosed with it. Me, I've been diagnosed with it, but then I'm so annoyed with it, I just live on with it. Because Americans just get it, they know it's not curable. So there's no cure to it, lotion on it, it's fine, they go on with their day. Now, to conclude everything, we did discuss how eczema is mainly in infancy and starts there, and it does die off afterwards. And we then discussed how psoriasis is found in the immune system, and that neither one of these things do go away. We talked about how both of them are the same and why they do get confused with each other. And so we have gathered all the information that we have between the differences and similarities between eczema and psoriasis. Thank you. That was so bad. Oh, that's okay. I get props though.
You were 7 minutes, 55 seconds.
And as I'm like,